All righty. Well, good afternoon, Mesa community. Welcome to our Safe, Strong, Ready series of Facebook Live. Today, we are joining you from Westwood High School's gym, and you're going to see a lot of action behind me and even some noise. This is our kickoff to a 6-day event of providing vaccines to our staff across Mesa Public Schools. So we're going to talk more about that, but I want to let you know that this is going on today, and we're going to give you lots of details about what this looks like. I also know that I could be making you a little bit dizzy, but you will see that we have a partnership here with Mesa Fire and Medical. We've got their staff as well as Mesa Public Schools Health Services that are here today providing vaccines. And we have Mesa Public Schools staff that are checking in our employees and making sure that we have a seamless process. So we're going to give you all the information about vaccines and what that looks like coming to Mesa Public Schools. So I'm Andy Forless, the very proud superintendent of this amazing school district. We know that COVID has been a tremendous challenge for all of us, and we are doing everything we can to up our mitigation, including vaccines. And so joining me is our Associate Superintendent, Holly Williams, who's a familiar face, who has dedicated the last 10 months to learning everything that we can about COVID and how to educate children in the midst of this global pandemic. So I'm going to turn it over to you, Mrs. Williams, to talk to us a bit about some of the latest mitigation that we are learning about coming out of the county and Arizona Department of Health Services.
Thank you, Dr. Forless. Welcome, everybody. Good afternoon. I'm so happy to be with you today. I'm glued to the picture behind Dr. Forless of Westwood, because I'm so excited to see the work that we have put in come to life. As she said, we are excited to bring vaccines for our employees. This is what we call a closed point of distribution, which means this is for our employees only, Mesa Public Schools employees, with our partnership with Mesa Fire and Medical. And it provides us an opportunity to get people vaccinated more quickly, get on the schedule, and get them get it in the neighborhoods where they work and many where they live. For some, it's a hardship to have to drive over to some of the the vaccine locations. And so this is an opportunity for us to be in the neighborhood where people are. So today we're at Westwood, and tomorrow we'll be at Mountain View, and on Friday we'll be at Dobson. And we are moving through the next 6 days, one at each high school. So I'm very excited about this opportunity for our staff and the ability that it gives us to see some light at the end of the tunnel for this pandemic, that we can be safer, stronger, and more ready to be in the classrooms with the children of Mesa every day and feel like we are protected from this pandemic. So excited about the vaccines, excited about the opportunity they provide. Some of the other mitigation strategies, I just want to reiterate a thank you. Thank you for reporting the cases in your homes and letting us know when you have someone sick, because that makes it better for us to be able to make planning around what is safe, what is available for teachers and staff. And so your reporting is important. It looks like Dr. Forless has some visitors, so I'm going to turn it back to her so she can introduce some of our team.
So I am excited to introduce to you part of the team behind the vaccinations. You will see Chief Mary Camelli. So Chief Camelli. And we have Michelle, who is the coordinator extraordinaire to make all of this happen. And over here we have Teresa. Big smiles to Teresa for all the great work that has been happening as well. As we know that this pandemic has taught us that we cannot tackle it alone. It has to be with our community partners. So the city of Mesa Fire and Medical, and Mesa Public Schools coming together to strengthen the health of our community. So I just want to say thank you to our visitors. Yes, thank you all. Okay.
What a great opportunity to say thank you to the folks who are working with us side by side to make this happen. you know, people don't know that we got word on Thursday that we were going to be able to do this, and even over a holiday weekend, we were able to put together this clinic with our high school leaders who said to us, absolutely, we want this in the arms of our employees, and they were willing to plan with us and get this going. So how exciting is that? So I was saying a thank you for your willingness to report, but I also want to say thank you for doing the health assessment every morning at home and keeping your children home when they are not well. It's helping us keep our children, other children safe, and our staff safe. So thank you for that. I want to remind everybody that masks are mandatory. We did open winter sports this week, and the athletes must wear masks, and we can only allow two parents or guardians in with each athlete, and only for home contests. So just know that we are doing everything we can to keep students safe and our staff safe, and we continue to need your help and understanding as we navigate this pandemic. So thank you for that. Thank you for paying attention to the mitigation strategies that we've put in place, because they are making a difference for us. So I appreciate that.
All right, and so Mrs. Williams, we've got some questions coming in around, will we be doing other vaccination clinics? Well, how else will we provide vaccines? So I'd love for you to share that with our community.
Absolutely. That's a great question. So we have this set that we're guaranteed right now. So that's how we were able to plan 6 events. But we have 2 other things in the hopper coming towards us, which are groups coming to us through our insurance carrier and through the state organization of administrators who have said, would you like to host? And we have raised our hand and said, absolutely. So stay tuned. We have more information coming about more opportunities for not only our own employees, but for other people in group 1B who are educationally related to be able to maybe have access to some of those vaccines. So stay tuned. I anticipate us knowing more about that in the coming weeks. I'm going to guess in the next week or two. If you remember last Wednesday, I said to you, I think I'll know in the next week or two, and I learned the next day. So I'm hoping if I repeat that language and I say, I think I'll know in a week or two, maybe I'll know something by the end of this week, and I'll be able to share more information early next week about what our next round of opportunity for vaccines will be.
Mrs. Williams, we have a question coming in from a struggling senior. A student is struggling. I'm a senior. When are we going to get back into school? What is that going to look like?
You know, we have for our high schools, we have large populations, and we took a very close look at the number of cases that are happening in the neighborhoods and happening in the schools, and asked questions of the administration team about what are the patterns you're seeing among cases. So I will tell you, in the case of all the decisions we made last week about learning models, they all are evaluated every week, and frankly, I watch them day to day. I watch the case counts. I watch what's happening in our county. I don't have specific zip code data, but once a week, but I do look at the case counts for Maricopa County to see what the trends look like. And I do know what's being reported to us so that we can make the best decisions. So our current plan is for all of our schools who are on remote or AB to be back to a 5-day modified on February 1st, Monday, February 1st. If all the data looks like that's a go. So I say that with a qualifier, because if we continue to see high numbers of cases, then it would not be the most safe environment to bring large numbers of high school students back in the building. So please, if you're struggling in your studies, please reach out to your teachers, to your counselors, see what kind of intervention is available. What can we do to support you in this remote learning? We know it's not easy, and we know it's not for everybody, but we know right now in the decisions we've made, it's the right decision because of the number of cases that we're seeing. Our goal is to keep you safe and to keep you learning at the best that we can right now.
You know, I think that's an important conversation, because we also know that behind every COVID case is a story. And so listening to the very important stories and the connections of the cases help to guide those decisions. We have another question that came through, and I think you might have already answered it, Mrs. Williams, which is, why is Mountain View remote, but the basketball team can still practice?
So that's a really good question. We take a look at it, just as Dr. Forlis just said, you know, case by case, circumstance by circumstance, and where are those cases occurring. So while the AIA sets the schedule for the winter sports, and it's a small team, we are monitoring that team closely for positive cases. If the positive cases occur on that team, then we quarantine the team. But right now, just as other groups could meet after school for things, that we allow the sports to go on. So I'll give you an example. If we're in an A/B schedule or a remote and there is an upcoming musical production, like a play or a musical, as long as they do all the safety mitigation and they keep things in small groups and they allow it to go forward, that would be allowed to go forward too, because we recognize the value and the importance that activities and sports play in the mental health of our students. So we recognize that, and we know that those are smaller groups than the 3,500 that would be on a campus every day at Mountain View. It's a big campus with lots of students, and so trying to control the numbers right now because of the high number of cases is important to us. Hopefully that answered it, Dr. Forlis.
Excellent. Looks like we have a smaller crowd today and smaller questions coming, a smaller number of questions are coming our direction. But this is a good time, I think, to talk about what we know about mitigation strategies and what's so important. There's some new graphics and some more heightened awareness that's happening from the county. Can you talk us through some of those?
Sure. Some of the things that the county has been sharing with us that I think really resonate with me, and I shared it last week with you and at the board meeting last week. I think it's so important for us to set an example. As you see Dr. Forlis there, she's among people, she's got her mask on and she's got it up over her nose and far onto her cheeks, and she's wearing it. And we can hear her just fine. She's got her microphone on and it's under her chin. That's a great example where we can be an example of how to wear a mask, right? And so the CDC and the county have shared with us that we play an important role, not only to enforce mitigation strategies, but to model them. So are we showing, when we walk into a building, do students see us using the hand sanitizer? When we walk into our offices, do people see us using the hand sanitizer? When we are out in a public setting like Dr. Forlis is today, are we showing that we're wearing our masks? When we're at the grocery store, can people see us? I know from the years of being a teacher and a principal, students see us and we don't necessarily recognize them, but they know us and they're looking for us to be models. So I ask you as parents and as teachers who are watching our Facebook Live today, your help in making sure that you are a model of these mitigation strategies makes a big difference, so that we can show our students what we expect when it comes to mitigation, and that we can help slow the spread of COVID. We know it right now in Arizona. We are struggling, and I believe that if we all up our game and recommit to mitigation, we will help to slow the spread of this terrible virus.
And Mrs. Williams, I know that you and Mrs. Hollins, who leads our information and communication engagement department, that you work very closely on the COVID dashboard in our school district. There's a question that we have that says, why doesn't the dashboard match the letters that I receive coming home?
Oh, that's a great question. Great question. Because the dashboard is updated once a week, but the letters, you get those every day because we want you to have the most up-to-date information to make decisions about the health of your children. So while we collect the information from those letters every week, we make sure that you know what's on there. The dashboard has a lagging bit of data on it. So we want you to know what's happening in our schools, but we feel like our letters are our most up-to-date information. Sometimes the numbers may be off because maybe in the dashboard, we know that the case has what do I want to say? The quarantine period for that student has ended and they are not contagious anymore. So you might have gotten a letter saying, hey, there was a positive, but you might not see it on the dashboard because we know that they didn't have any contact with you, especially these weeks, excuse me, right after coming off of winter break and the 2 weeks of remote that we started the semester with. There is going to be you're going to go, why I didn't get a letter for that, but I see something on the dashboard. It's because the student hasn't been at school for the letter to generate. It's contact with other children or adults that generates those letters. So that's why you sometimes see some differences. I tell you, if you haven't taken a look at the dashboard lately, it has some nice updates. And I would point you to the footnotes because there's a lot of really good information, and a lot of us just look at the numbers and the colors, and we don't pay attention to the small print. The small print actually gives some really good insight to how the workings of that dashboard and how we build it and the dates that it covers and those kind of information. So I would encourage you to look at the small print.
All right. And as I am looking at our questions, we've got some questions just again around understanding the data and using the data. And I think it's important to talk about that. We know that not everybody has the same level of understanding of the data, and what we have access to and what we have made sense of has changed over time. There is so much more information coming our way. So now that we have vaccines, for example, among our staff, that will be a question. That will be a part of us deciding what a learning model looks like is our, have that teaching staff, have the staff at the school, what percentage of them have chosen to be vaccinated. So we constantly take a look at adding other important pieces of data. So if there's anything else, Mrs. Williams, that you think that is important to share with our community today, the questions are pretty slow coming in, and we've got a smaller audience. I don't want to have everybody feel like they got to hang on with us till 4:30. But if there's any words of wisdom, any plea to our community, I think this would be a great time to share that.
You brought up a good point about the data and how we've learned over time, because when we first opened in the fall, we had a lot of people say, just use the information from the state and make your decisions. And frankly, that's all the data we had. But now that we've been open and we've had kids in our buildings and we've been able to track case counts among our staff, among our students, that's given us a new perspective and some more information. And it's not enough just to take a look at one or the other without asking some questions. And I've shared with you before that sometimes there are cases where, you see 4 or 5 cases at a school and where you think, oh, that's concerning. And it is. 4 or 5 cases at an elementary school, it's a smaller size school, that is concerning. But then you learn that it's a sibling group, that they've all gotten sick. And you know how that, if you've had COVID already, you know that tends to go through the family pretty quickly. And so it's not surprising that if there's 4 or 5 cases and there's 4 or 5 children in that family, or maybe the mom works at the school, that could happen. So please know that the decisions are not easy decisions about when to switch a learning model or when to engage a B or a remote setting. We don't make those decisions lightly, and we do them classroom by classroom, school by school. We look at the risk factors involved in the classroom. How are the mitigation strategies? Do we feel confident that the students are safe? Do they have other concerns? How large is the school? How big is the spread? I mean, we ask ourselves so many questions before we make a decision around changing a learning model. So know that the decisions are day to day. We made the decisions last week to impact the reopening of our schools after winter break, but now that most of them are reopened, we will reevaluate those ones in time for the February 1st opening, the 7 that we have in remote and the others that we have in AB. And then we will move forward with everybody else who's in 5-day, day to day, classroom by classroom. Those are the conversations we're having about what should be open and not. So I know I can't say it enough. I hope you feel reassured that it's not one size fits all for everybody. It's taking a look at what each school is experiencing, what the community spread is, what the numbers tell us, and making those decisions. So I wanted to just reemphasize that, because I know there's always questions about how come my school and not this school, and because the story at your school might be different than what's happening at another school. So and know that we dig into those stories so that we make sure we have a full picture before we make a decision.
Yeah, I appreciate you sharing that level of detail, because I think that that's important. While some are looking for a crystal clear formula or number, COVID just doesn't work that way. And it certainly doesn't have an impact into families and into our schools in the very same way. So as we wrap up our time today, we've got some thank yous in the chat for making the vaccines available. I want to say thank you to our community. Thank you for hanging in there with us. This has been a very unusual year, to say the least. And I want to say thank you for the team within Mesa Public Schools, Mesa Fire and Medical, and the city of Mesa that made this available, along with Arizona Department of Health Services. This was a gift to us that we are grateful for. And I just want to say you're welcome, and we thank you as well. So have a wonderful afternoon. We will see you next week. Those of you who would like to join, 4 o'clock, we'll be right back here. So thank you very much. Have a great rest of your evening. Bye-bye.